Hello friends, let us now learn some important points about globoid cell leukodystrophy or Krabbes disease. It is autosomal recessive disease occurs due to the deficiency of enzymatic activity of galactocerebroside. Whenever there is deficiency of enzyme activity of galactocerebroside, this results in Krabbes disease. This leads to the accumulation of galactosylceramide gets accumulated in white matter of brain. Okay, in white matter of brain, you will see accumulation of galactosylceramide, and because of this, the baby develops symptoms in infancy itself. Here, the baby develops seizures, irritability, hypertonia is seen, and by the first year of life, the baby develops optic atrophy because of the accumulation of galactosylceramide, and there is mental development is impaired severely, and as disease progresses there will be mental developmental delay, and you see opisthotonus is seen in these patients. There is hypertonia and death occurs by the age of 3 years of age. And if you wanted to demonstrate, you will have to demonstrate for diagnosis, you will have to demonstrate this enzyme deficiency should be demonstrated in WBC or skin fibroblasts. You should demonstrate the enzyme deficiency. So this is about Krabbes disease. Thank you guys for watching my lecture. Thank you.